Dr. Gerald Cohen is the Director of Clinical Affairs for the Division of Mental Hygiene at the New York City Department of Health and Mental Hygiene. And I can tell you he's no stranger to Navy ships like the Intrepid right here, because he once served as a Navy psychiatrist responsible for mental health services aboard the USNS Comfort. He currently oversees policy evaluation and initiatives promoting health information for all New Yorkers. Please welcome Dr. Gerald Cohen.
Good morning, everybody. It's a pleasure to be here. It's a pleasure to be back on a naval ship. It brings back a lot of good memories for me. It's great that we have beautiful weather to celebrate Behavioral Health Recognition Month here at the Intrepid. It's a wonderful opportunity for our community, our consumers, family members, providers, and advocates to educate and spread awareness of mental health and substance abuse issues. Mental illness affects all of us. Whether we've experienced a mental illness, know a loved one that has suffered, many of us, including myself, have lost friends or coworkers to suicide. We know that mental illness is common. It affects about 1 in 4 Americans every year. Another quarter of these folks, another 1/4 of these folks, about 6% of American adults suffer from what we call a serious mental illness. These are conditions such as schizophrenia, bipolar disorder, major depression, post-traumatic stress disorder, and others that can cause great suffering and are often very disabling. Many also suffer from both mental illness and substance use disorders at the same time. We call this co-occurring disorders, or dually diagnosed or dual disorders. More than a quarter of adults with serious mental illness have co-occurring disorders, and nearly half of adults with substance use disorders have a co-occurring mental illness. Now, many folks outside of our community don't realize, they're quite surprised to learn the extent of how disabling these conditions can be. When you look at the years of productive life lost and premature death, mental illness and alcohol and drug use disorders are the leading causes of disability here in America and in other industrialized nations. Depression itself is the single leading cause of disability compared to all other health conditions. The good news is that we've never before had so many effective treatments and therapies, evidence-based practices, medications, types of psychotherapy, and other interventions. The bad news is that many who can benefit are just not getting these treatments. I think the numbers speak for themselves. Less than half of adults with serious mental illness are getting treatment. And while about 60% of those that have both serious mental illness and substance use disorders receive treatment, only 1 in 10 of these folks are getting the treatment they need for both mental health and substance use disorders. These numbers are tragically even worse in children and teenagers, where fewer than 20% of those in need are getting any mental health services. Here in New York City, over 400,000 adults, about 7% of our adult population, suffer from depression every year. Only about 1 in 3 of these individuals are getting treatment. We have a lot of work to do. We also have a lot to learn about prevention of mental illness and chemical dependency. We have to learn about how to prevent these conditions before they start. We know that early detection through screening and educating people about the warning signs of illness can get people started on treatment sooner. We can get people into treatment sooner, and we can reduce their symptoms and problems before they get worse. We can minimize the potential for long-term problems and disability. That's why events like this one are so important, because we need to continue to raise awareness and education about mental health and substance use disorders. We need to be vocal about our core messages that we know can help educate and reduce stigma, that mental health and substance use disorders are real illnesses. It's not a character flaw. Just like other health conditions, they are treatable. Help is available. Recovery is possible, and that treatment works. Treatment is effective. These are the key messages we need to keep repeating, and we need to repeat them loudly so that we can help reduce stigma and get more people into treatment. We need to make sure that our message has a wide reach, and we need to continue to engage and educate those who can help spread awareness and are in a position to help refer people in need for services: teachers, employers, faith and community leaders, probation officers, those individuals working with the homeless and the elderly, and people with serious medical conditions, and other people who are in a position to help and work with vulnerable populations. We've done a lot here in New York City to train and educate primary care doctors and nurses how to screen and assess their patients for depression, PTSD, alcohol and substance abuse, and other common conditions. These doctors are often in the best position to detect these conditions early. We've provided evidence-based treatments, evidence-based tools and trainings. We've even embedded these tools within electronic health records, electronic medical records, so that doctors using them can have these tools accessible right at their fingertips when they see patients, and so they know what to do and they're ready to provide initial interventions and refer people to the treatment they need. We in the behavioral health community also need to be vigilant about screening. We need to make sure that there's good screening for mental health conditions in chemical dependency programs, and that when patients come to mental health programs, we can do the same and do a good screening for substance use to make sure we're getting folks the right treatment at the right time. I want to mention another type of co-occurring disorder, though, that's a major public health concern. We've become more aware in recent years of the alarmingly high rates of chronic medical disease in our community. People with serious mental illness are dying an average of 15 to 25 years earlier than the general population. And they're suffering from chronic medical illnesses younger than they should be. This is a terrible health disparity that we must pay attention to. These premature deaths are largely due to preventable medical conditions, conditions like diabetes, heart disease, lung disease, infectious diseases, the same public health epidemics that are the leading killers, the leading causes of death today in our population. Our community shares a disproportionately high burden of these medical conditions. We know that many risk factors like smoking, poor nutrition, being overweight, getting limited exercise, and drug abuse all can play a role. Poverty and unemployment, social isolation, homelessness, and stigma can affect illness and limit access to good care. Some medications that we use to treat mental illness can worsen or cause weight gain and risk of diabetes. Our community has been active in helping people reduce these risk factors, though, and helping to empower people to take an active role in managing their physical health so that they can lead happier lives. These efforts include ensuring regular screenings for unmet health needs, helping people connect better with their primary care doctors. This also includes peer training and peer counseling to support people to make healthy lifestyle choices and to help them communicate better with their doctors about their health and about their medical care. Many offer group activities that promote healthy eating and exercise that reduce social isolation and can help. Providers and peers are now routinely educating people about the health risks of tobacco use. And many clinics, housing programs, and clubhouses are offering smoking cessation treatment. We need to do more to reduce this health disparity. We know that good preventive care and medical treatment requires that our doctors talk to each other. This can be challenging, given the way our system of behavioral health and primary care are separated. They tend to be siloed from each other. Timely communication about our treatment needs and medications, our lab results, and other health status information facilitates better treatment for us and can reduce errors and avoid duplication of services. One way we can address these is to take advantage of emerging health information technologies, the use of computers, and the use of electronic technology in healthcare. In New York City, we've been fortunate to have a strong initiative, our Primary Care Information Project, that has helped thousands of primary care doctors adopt interoperable electronic health record systems. These are record systems that help doctors share information, provide higher quality of care, reduce medical errors, and better communicate with each other. The behavioral health sector has been lagging behind in adoption of these exciting technologies, and we're working hard to help us catch up. These are important developments so that we can reap the benefits of these systems. An important part of these systems are they give us the access to see our personal health records. This will allow consumers to have greater access and control over their personal health information, and to make it much easier to communicate with their doctors. These tools will help us improve coordination of care for those who need it most, and empower our patients to be more involved in their care. This will also help us move forward towards a person-centered focus of care, where we are treated as a whole person, with all of our doctors and therapists and treatment providers working together as a team to give us the best healthcare possible. I'm happy to say that we've made significant progress in these areas here in New York, and will continue to promote behavioral health and physical health prevention and awareness efforts. I'd like to thank you again for the opportunity and honor to speak with you today, and for your continued support and help in helping all of us have good behavioral health and helping New Yorkers live longer and happier lives. Thank you very much.